Dear doctors, today we are going to discuss about the stages of the labor. So before going through the stages of the labor, I just want to say something that uh, whenever the product of conception, whenever the fetus completed developmental stages and it completed growth inside the mother uterus, then definitely it have to come out from the mother uterus to the external environment. For that purpose, God make a different very strange and beautiful physiological processes, that is the uterine contraction and cervical dilation. So for the baby, the strong uterine contraction push the baby down, while the dilation of the cervix causes and help in the descending of the fetus. So let's go through the stages. So stage of the labor, there are three stages. The first stage, it started with the onset of the uterine contraction and ends with the complete cervical dilation. So it started when the oxytocin level increases and it causes the strong contraction, and this strong contraction start to push the baby down, and it ends when the uterus completely dilate. So it further divided into two phases. Number first, latent or the early stage. Number second, active or active stages. So the first, there is latent or early stage. So what are the characteristics of this stage? In this stage, the contractions are regular. Contractions started but not so intense. 5 to 30 contractions per minute. The contraction lasts for 30 seconds. It lasts for 14 to 20 hours. In case of premipera, the hours and the time duration is less than or approximately 20 hours, because premipera means the mother is going to give her first baby. And in case of multipara, it is less than 14 hours. Multipara means if the mother gave already birth. And the cervical opening start from 0 till 3 to 6 centimeter, and the speed of dilation of the cervix, in case of multipara, it is 1 to 1.5 centimeter per hour, while in case of primipara, it is 1 to 2 centimeter per hour. So we can say that it is a stage in which the contraction are not so intense and start the maximum contraction, and it persists for 30 seconds for less time, and then start to push the baby down. So what about the other stage, that is the active stage? The active stage characteristics are the regular contractions. The durations start to decrease. For example, the interval between one contraction, the another contraction, that decreases, and the the duration. For example, one contraction, it leads to for more than 30 seconds or till to 60 to 90 seconds it persists. So contractions are intense as strong contractions, 1 to 2 contractions per minute, and contraction lasts for 60 to 30 seconds. It lasts for 30 minutes to 3 hours. The cervical opening start from 6 to 10 centimeter. Okay, so 10 centimeter is the complete dilation of the cervix. The speed of dilation of the cervix in multipara is more than 1 centimeter per hour, while primipara is more than 0.7 centimeter per hour. So here we can see that the first stage, the latent stage, and there are the active phase. So in case of latent phase, we can see that the uterus start to contract while the cervix is start to dilating, but the cervical opening is a little bit open and the cervix is thick. While if we see in this case, we can see that the cervical thickening become very less and the cervix become thin, and the dilation increases. So this thinning of the cervix is called as effacement. So we can say that in active phase, the effacement increases, the dilation also increases. So what are the abnormalities or the problems with which we have to interact in the first stage, that is prolongation disorder, that the stage instead it complete in 14 to 20 hours, it leads to more than 20 hours. So that is called as prolongation disorder. Why prolongation disorder, I will tell later. And arrest of the cervical dilation, the cervix start to dilate, but it doesn't go in a complete dilation. Why? Because due to the hypotonic contractions, analgesics, pelvic abnormalities, if the contraction is not so good, okay, then definitely the stage will prolong. And what are the management? Massage, we have to do massage, that is called stimulations, and intravenous oxytocin injections, 10 international units we have to introduce to the mother intravenously, so the contraction enhance and the contraction become more intense. If still nothing happen, then we have to do cesarean delivery. So the second stage started with the complete dilation of the cervix, and it ends with the delivery of the fetus. It start with the complete dilation and ends with the fetal delivery. So it lasts for 2 to 3 hours, less than 3 hours duration in primipara, and less than 2 hours duration in multipara, and the cervical opening is completed or completes complete opening of the cervix, that is 10 centimeter. And what is the purpose of this stage? That it help in the descent of the fetal presenting part and completion of the cardinal movements. So if the contraction of the uterus is there but there is no dilation of the cervix, then it is not possible for the baby to come out, so there is no descent. So for the descent of the presenting part of the fetus, it is necessary to complete dilation of the cervix. And the cardinal movements we can discuss in next lecture about the cardinal movement. So what are the causes? The causes are the hypotonic contraction, discoordination, coordinated contractions, and cephalopelvic disproportionations. So if the cervix is completely dilated but still the baby is not coming out, it means that the diameter of the female pelvic and the diameter of the head of the fetus is not correspond. They are not perfect. Either the pelvic is small, the fetal head is normal. Either the fetal head is increase in size or bigger than the normal one, while the pelvic is normal. So in that condition, definitely the baby cannot descend down. So in that condition, we have to perform cesarean section. So the management, that intravenous oxytocin, in order to increase the contraction, the forceps we can use to make the fetal presenting part in a correct position, and vacuum extractor in order to extract. If still nothing happened, then we have to perform the cesarean section. So here we can see the different stages. The first stage, the dilation, okay, and then there is a complete dilation, then the baby start to come out, okay, and finally the baby come out. So this is what the first stage and the second stage. So what about the third stage? The third stage started with the delivery of the fetus and it ends with the delivery of the placenta. So in this condition, what happened? The main purpose of this stage is the extraction or the delivery of the fetus. So it lasts for 30 minutes, and the purpose is the extraction of the placenta. And abnormalities, definitely the problem we can see in third stage, that the prolongation disorder, that if there is a problem in extracting the placenta, if the contraction is not so severe, if the mother is tired and cannot push further, then in those conditions this stage goes prolonged, and there is a chance of excessive bleeding, there is a chance of thromboembolism, and there is a chance of infection, because the mother blood directly come in contact with the external environment. And the causes, there is hypotonic contraction, discoordinated contractions, and abnormal placenta. So here we can see the extraction of the placenta and the delivery of the placenta in this case, okay. So what are the management? There are management of the third stage is very important to remember this management, and very important to perform this management for the normal third stage process. Number first, that is intravenous oxytocin. So when we administer intravenous oxytocin, then there is a less chance of postpartum hemorrhage because there will be no excessive bleeding. It causes the uterine contraction. The prevent traction of the cord. Once the baby come out, we have gently have to grip the umbilical cord and start to push slowly and slowly, and inhibit the retraction of the cord. If we didn't do so, then there is a chance that after cutting the umbilical cord go further inside. And the third point, that is clamping of the umbilical cord. We should clamp the umbilical cord, and there is a distance of 1 to 2 centimeters between the two scissors. and after that you have to perform the uterine massage. So here we can see that giving the intravenous oxytocin, here the performing the control traction, holding the umbilical cord, and then clamping of the umbilical cord, and finally and there is a massage. Okay, he's doing massage of the uterus. So there are some signs which we have to remember, that from these signs we come to know that the placenta is separated or not. So the signs of the placental separation, that the fresh bleeding, lengthening of the umbilical cord, and the fundus rise up. So here we can see that the fundus is rise up because fundus is going down as we extract, as we pull the placenta out. Placenta bring the uterus down. So when the placenta detach, this curved area become flat, and uterus is go to the normal condition. So here we have the placenta after extraction of the placenta. So after that we have to see the placental surface and placental membrane to confirm that we have completely we perform complete extraction, or there is still some part into the mother uterus. So this is about the stages of labor. Thank you.